Hi, I'm Undrea Russell, support staff for the Southeastern Michigan HIV/AIDS Council, SEMHAC. I want to take some time to tell you why it is important to become a member of SEMHAC and the benefits that you'll receive, whether you're a person living with HIV or a provider. Planning councils were established to ensure people living with HIV and their allies had the power to make decisions regarding health care for people living with HIV. It's the planning council members who make data-driven decisions through a process of needs assessments, epidemiology, and feedback from providers to determine where federal Ryan White funds are needed most to help improve the quality of life for people living with HIV. When we return, we'll talk to a new member of SEMHAC to find out why they decided to join.
Why join the Long Range Strategic Planning Committee? There's a variety of SEMHAC committees that gather data, implement programs that help improve the quality of life for those living with HIV and AIDS. But the Long Range Committee is where the rubber meets the road. Long Range Committee is the committee that ensures people living with HIV and AIDS get the quality health care they need. Long Range also monitors the way people receive that health care. This is the core of SEMHAC mission statement. There is a position waiting for you on the Long Range Strategic Planning Committee to help make a difference in the lives of those living with HIV and AIDS and our DEMA. Go to the SEMHAC website and apply.
Welcome back. Each year, several individuals will join SEMHAC. We spoke to one of our newest members to find out why they decided to join SEMHAC.
Hi, I'm Lawrence, proud new member of SEMHAC. Now, I'll be honest, probably like some of you, I heard of SEMHAC, but I really didn't quite know what SEMHAC actually did until a good dear soul at Unified HIV Health and Beyond shared an email with me about Project LEAP, which is a training course offered by SEMHAC. Now, Project LEAP stands for learning, which is something I love to do, empowerment, we all can use that, right? Then the A is for advocacy and the P is for participation. Now, SEMHAC is a community of hearts standing together to end the HIV epidemic, EHE. 90-90-90 by 2030 is our goal. So during my final days of Project LEAP, I realized how I could help my community even more and in a much bigger way to end the HIV epidemic and the stigma surrounding our differences. This is why I am a SEMHAC member. We are louder and stronger together. Teamwork makes the dream work. And ending the HIV epidemic, EHE, begins with you.
Becoming a SEMHAC member is an opportunity to help both marginalized and disenfranchised populations. SEMHAC focuses on breaking through the healthcare disparities that prevent and/or hinder people from getting access to healthcare and other services, such as housing, financial assistance, transportation, and more.
Hi everybody, I'm Deborah Stewart Anderson. I am the Needs Assessment Co-Chair with SEMHAC along with Amy Jacobs. And I want to talk to you a little bit about our Needs Assessment Committee. Our committee is responsible for the identification and documentation of unmet needs of people living with HIV/AIDS, those who are in and out of care, and those who are unaware of their status. Our committee also identifies gaps in HIV service system within the Detroit eligible metropolitan area. We looked at a duplication of services and barriers to care. Through survey, focus groups, and other information gathering tools, every 5 years, we are also we're also responsible for the working with other committees to produce and update HRSA's, which is Health Resource Services Administration Comprehensive Plan, which focuses on 4 areas or pillars. Please join us in helping SEMHAC to carry out their mission and their vision.
One consistent thing about HIV is that it's ever changing. With new developments in treatment and prevention, providers who are SEMHAC members have an advantage. You get access to the latest information and see firsthand any trends or issues that have an impact on the HIV community.
So when we say providers, we mean pretty much anybody who touches the life of people living with HIV or doing prevention, public health, in clinics, in community-based organizations. That's you. Being part of SEMHAC can change your practice, and it can change the community. You get kind of a behind-the-scenes look at finances, at needs in the community that maybe your small organization wouldn't have been able to do just by itself. You get access to some of the funders and get to a first look at some grants and resources and partnerships. You get trainings, which are really awesome through SEMHAC. You get to do a lot of collaboration and ideas and building capacity for the things that you are already trying to do, and in general just the work that we as a community are trying to move forward for our people here in southeastern Michigan, trying to end the epidemic. So that is why you should join SEMHAC.
If you're interested in becoming a new SEMHAC member, the process is simple. Just go to semhac.org. There you'll see a link for membership. Whether you're a provider or someone living with HIV, when you join SEMHAC, you'll become part of a process that extends and improves the quality of life for others.